For many people, feet are not just physical, they are symbolic. Steps forward involve feeling pain, coping with loss, and overcoming life's circumstances. These are core to identifying, but also living with chronic disease.
The foot is just the door to opening the cause. One thing that's so difficult to understand is that when you don't feel pain, it's not good, because it's the pain that makes you aware of the problem. And when you don't have it, the bigger ones come.
That was Mr. Puccio. He lives in a community outside of Newark, and he credits his current life in part to care provided by podiatrists at Newark's Essential Hospital. Yet most people do not consider podiatry to be critical to survival.
I didn't want to deal with death and dying, thinking that, oh boy, nobody's going to die on my watch, nobody's going to have these major earth-shattering issues. Little did I know that with diabetes, I'm telling people that I have to amputate a part of you, and for some of them that's just like death. One thing we try to do also as a team is not to whittle. There's a perception out there that oh, I'm a diabetic and you're telling me you're going to amputate a toe. So today it's a toe, next month it's the second toe, 6 months it's the foot, then it's a below knee amputation, and then I'm dead. We try to coordinate so that let's try to pick the right level of amputation so that it's almost one and done.
Mr. Puccio, how are you? There he is. He didn't have to get arrested.
How are you?
Magnificent career here. Believe it or not, I looked at that podiatry as being the first line of care for me. And they started to see that I had complications with my feet. That was the first indication that I had the diabetes. I have neurological problems. I had a stroke. I had cardiovascular issues. I have retinopathy. And these conditions at the time I got them was all diagnosed from my feet. The feet spoke.
But with diabetes, they have to work by it. So, we try to also emphasize, we're doing this, okay, but now you have to do your homework. You have to keep your blood sugar where it needs to be. You have to do your regular visits. If we say go get a prosthesis, you have to go get a prosthesis. So examine your feet. There's a lot of, it's not like hypertension. You take your pill and that's it, and avoid salt, big deal. There's a lot of work that goes into it. And you have to get that through to them. And some are just, they really don't get it. A lot of times when you ultimately amputate, that kind of jump starts them getting it, because it's almost like they found religion and now I better start. Whoa, this is pretty serious now, pretty serious.
Mr. Puccio, in fact, has had his toes amputated. He learned he had diabetes. He also found out that he lost feeling in his nerve endings, making it impossible to feel pain in critical locations. He may not know if he's having a heart attack. He may not know if he has to lose another toe, unless he takes the first step, unless he takes an active role in his health care.
They didn't sugarcoat it. They told me what I had, and I had to face up to the fact that they can tell me, but it was me who had to make the changes. Because when I look at it, I realized that there's a mortality to this that I didn't see before. But I was probably a little bit more cavalier than I should have been with the fact of taking the right caution to food and to medications. That I wish I could do over, but there are factors that led me to that. I want to have a healthy life from here if I can, and I can't do it unless there's certain treatments that I do.
And it isn't just for diabetes. Podiatrists focus on prevention. The idea of limb salvaging is really a team effort. These providers partner with these patients to prevent the loss of any more limbs.
I think it's just a matter of being honest with the patient. We're not deliberately going and trying to amputate something. It's actually the opposite, trying to prevent all this from happening. And we do a lot to prevent limb salvage and prevent amputations. But you have to be honest with them and tell them, almost sometimes be very frank with them as well, that we're doing this for a reason. These are the reasons why. We're going to do our best, obviously, and try to get them, back on their feet and healthy and up and moving again.
The hulking 7'2" Luther Wright is a former Seton Hall center. He was one of the focal points of the Pirates' 1993 Big East championship team and left after his junior season to go to the NBA.
In his memoir, Wright details a breakdown and how he turned to drug use. It was frostbite that eventually brought him to Dr. Cook, and ultimately his critical turning point.
I had turned into a full-blown addict, homeless, sleeping in abandonments and cars and stuff like that, just chasing drugs.
Yep.
The doctor came in the room and was like, "Mr. Wright, we got to perform the surgery on you. Your toes, it's like, we can't save them." And I heard him. I was high though. I heard what he said, but it was like, what? I'm gonna cut my toes off. But then he came back. It was like, we can't put you under local anesthesia because they were scared I might have a heart attack with all the drugs that was in my system. So they numbed me from my hips down to my feet, and I heard him cut my toes off. My toes hit the pan like ping, 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 like ping, ping.
When was that breaking point for
When
you?
they cut them 2 toes off my right foot, man. I wasn't taking care of myself. Sleeping outside in the winter. My toes got frostbit, and I ended up getting 2 toes cut off. I'm glad they cut my 2 toes off.
That was December of 2004. Wright decided he had to change his life. He got himself clean and married his wife Angela in August of 2007. He also started to get back into the Seton Hall family.
Across the country, essential hospitals are providing this often overlooked entry into the healthcare system. San Antonio, Texas has one example of an essential hospital dedicated to addressing the complications that can be first discovered by your feet. And the community takes part.
Well, the Texas Diabetes Institute is a very unique facility. It's in the heart of the community where people need it most. And it's been here almost 15 years now. And it's easy access for those. If you look at the zip code where this particular institute is located, it has the largest number of people diagnosed with diabetes. And so there's been a lot of community involvement from the point of our development of the infrastructure to the design and into the services. And we have advisory councils that give us guidance with that. And so there's just good access. A lot of work still needs to be done in terms of just the overall makeup of what we do in this community. And it's not really owned by the healthcare system, it's owned by our community and how we encourage exercising or encourage healthy eating, or work with the YMCAs or work with the schools and really engage everyone in the issue so that we can have a better outcome in the future. This community is very thankful for this facility. And so anytime they might even envision a slight concern with crime, they'll call our police officers and say, somebody's tagging your facility or somebody suspicious looks like they're walking in your parking lot. So they take ownership by taking care of it. And they know that if we can't maintain this facility for whatever reason, that it's a loss to everybody, because this facility not only generated opportunity for access to care, but it generated jobs, it affected the economy, and it helps with the education. It helps young people in this community realize that they can be part of the healthcare team at a later age and understand what's happening here. So it has a lot of positive impact overall. And so, we're really proud of this facility. I can't tell you how proud we are of it.
With changes under the Affordable Care Act, more people have more access to care and resources. The country is moving away from using emergency departments as primary care and instead focusing on screening and prevention. And that change is empowering. Back in Newark, the providers and patients feel it.
The emergency room's only job is to treat the issue at hand. They're not doing prevention. So when that Medicaid patient who would always go to the emergency room now gets assigned a PCP, when was your mammogram? I never had one. Well, we're getting signed up. When was your colonoscopy? Never had it. Now you can sign up.
I wasn't just saying, well, you know, I had the colonoscopy or I had this condition and it took care of it. It made you understand that you're not going to get any better unless you take the initiative. And so these problems that I had, developed from diabetes, made me also realize I can make changes. I can make myself feel better and move forward in the right direction.
Now that more patients are being enrolled in Medicaid programs, some of them come with prescription plans as well. So they're able to obtain some of their medications. We're talking about diabetes and earlier about just the non-compliance because they cannot obtain the medication. If they're on charity care or indigent care of some sort and they're paying out of pocket, it could be $400 for insulin pens. And a lot of the patients, especially in this localized area, they don't have that kind of resources.
You could take care of your foot problems, but that's only just part of it. Now, there's no question about it. You have to be part of the care. You have to make the difference. They could tell you, but they're not coming home with you.
Like Luther Wright, Mr. Puccio lost his toes, and that was his wake-up call.
And then being in the hospital and having to face the fact that I lost 2 toes and the prospect of what else could happen in the future wasn't too appealing to me. So I had to make the change. In 2 years, I lost 130 pounds. I have to accept the fact of where I am today. Nothing's going to change that. But what I did find is that I can make my life better. Because I have this condition doesn't mean I don't have to stop living. I found out that if I do the right things, I can have a good lifestyle. It won't be the one I wanted, but it's one that I can accept. And that's the best you can ask for.